Today, we're jumping into a topic that so many people struggle with in silence: chronic Lyme. We're going to break down why the standard treatments can fall short and walk through a different way of looking at what our source material calls a hidden cellular war. All right, let's get into it. This is the question, isn't it? It's probably the one that brought you here. You did everything you were told. You took the medicine, the doctor says the tests are normal, but you're still feeling awful. If you've ever been told you're cured but you feel anything but, then this is for you. So let's talk about this massive disconnect, this gap between what the test results say and what you're actually feeling every single day. To really get it, our source material walks us through a story that's going to sound really familiar to a lot of you. So let's look at Maria's story. It's a classic pattern. She gets a tick bite, tests positive, takes the standard 3 weeks of doxycycline, and boom, her follow-up test is negative. The doctor says you're cured. Case closed, right? Well, not so fast. For the next 3 years, things just get worse. Crushing fatigue, brain fog, joint pain. And what happens? She gets told it might be fibromyalgia or chronic fatigue, or maybe it's just anxiety. The active infection was gone, but the damage, the real biological fallout, was just getting started. This brings us to the absolute core of the issue. Why does the standard treatment fail so many people? The answer, according to our source, has everything to do with just how smart and sneaky this bacteria really is. This analogy just hits the nail on the head. It's so perfect. You mow the lawn, and yeah, it looks great for a week, but you didn't pull the roots, so of course the weeds are going to come right back. Well, that's exactly what's happening with the Lyme bacteria Borrelia. And this table shows you exactly how. See, standard antibiotics, they're great at killing the active bacteria, the spirochetes that are swimming around in your blood. That's why your test comes back negative. But Borrelia has a couple of tricks up its sleeve. It can shift into these dormant persister cells, or it can hide out in these fortress-like communities called biofilms. Your antibiotics can't get to them there. They're just hiding, waiting to cause problems later on. Okay, so if antibiotics are the lawnmower, then what can actually get in there and pull out the roots? Well, this is where it gets really interesting. Our source points to some major research from Johns Hopkins in 2020, where scientists went looking for compounds that could take out these persister bacteria. And what they found was pretty mind-blowing. They tested a whole bunch of different compounds, and 2 botanicals, Cryptolepis sanguinolenta and Japanese knotweed, were actually better at killing the dormant Lyme bacteria than the standard antibiotic, doxycycline. And let's be clear, this isn't just some fringe idea. This is peer-reviewed science coming out of one of the top institutions in the world. But here's the thing. Even if you deal with a hidden bacteria, the initial infection sets off this chain reaction, this cascade of damage that can last for years. It's not just an infection. It's a full-on war happening inside your cells. Let's start with what's happening in your brain. You know, even little leftover pieces of dead bacteria can keep your brain's immune system on high alert. These cells start pumping out these inflammatory signals called cytokines. Think of it like your body's fire alarm just stuck in the on position. And that constant alarm is what causes the brain fog, the memory issues, the mood swings. It just keeps feeding itself. So that feeling of brain fog, it is absolutely real. It's inflammation in your brain. And that same inflammation, man, it just wrecks your hormones. Your brain is supposed to send out these really precise signals to manage everything from testosterone to progesterone, but those inflammatory cytokines act like static on the line. They jam the signal. And what happens? Hormone production just tanks. This is a huge reason for the fatigue and all the other symptoms that so often get brushed off. Now let's talk about energy. I mean, the kind of soul-crushing fatigue that comes with chronic Lyme. To get it, you have to understand mitochondria. Just think of them as these tiny little batteries inside every single one of your cells. They make the energy, the ATP, that powers literally everything you do. Well, chronic inflammation is like acid rain for these batteries. It creates all this stress, it directly damages them, and it burns through a critical fuel source called NAD+. Without enough NAD+, your energy production just grinds to a halt. It's why all the coffee in the world doesn't touch this kind of fatigue. You're not just sleepy, your cells are in a literal energy crisis. So after hearing all that, the hidden bacteria, the brain inflammation, the hormone crashes, the energy crisis, you're probably wondering, okay, so what on earth do you do about it? Well, the source material lays out a game plan that's designed to tackle all these root causes at the same time. Let's see how it works. The whole philosophy is actually pretty simple. It breaks down into 3 steps: repair, restore, and rebuild. See, the goal isn't just to kill some bacteria. The goal is to first repair the out-of-control immune system, then restore cellular energy while targeting the hidden bugs, and finally rebuild the systems that got damaged along the way, like your hormones. And here are some of the tools the source talks about for each step. For the repair phase, something called low-dose naltrexone to help calm that inflammation in the brain. To restore, you've got those botanical antimicrobials we just talked about that can get to the hidden bacteria. And to rebuild, therapies like NAD+ IVs to directly pour fuel back into those drained cellular batteries. Now, something this complicated doesn't just go away overnight, and the source is really clear about this. It's so important to have realistic expectations about what the path to getting better actually looks like. And I actually love how transparent this is. This isn't some promise of a miracle cure in a week. It's a real timeline based on how the body actually heals. You can see things like sleep and pain often get better in the first couple of months. But the deeper stuff, the energy, the brain fog, that takes longer. We're talking 3, 4, even 6 months to see that really big lasting shift. And they even put some numbers to it. The goal is to see a 30 to 50% drop in symptoms by about 3 months, and hopefully a 60 to 75% improvement by the 6-month mark. This gives you a real tangible way to track your progress instead of just wondering if you're getting better. As we start to wrap this up, I want you to really let this quote sink in. This gets to the heart of it all. It pushes back against every doctor who might have suggested it's just stress or anxiety. It puts the problem exactly where it belongs, not in psychology, but in biology. And that's really the big takeaway today. If you've ever felt dismissed, if you've ever felt like your suffering wasn't being taken seriously, the message here is one of complete validation. The fight you're in isn't imaginary, it's real. And it's not in your head, it's in your cells. Thanks so much for tuning in.